Governor Abbott. My name is Lamont Darden, resident of Allen, Texas. I have a question for you relative to mental health in the black community. The question is, are there programs in place to support mental health? If not, what are your plans to create these programs to make the community aware that they exist? Thank you.
It's a good point, Governor.
It is a good point, and I'm glad Lamont asked it because people need to know, and they need to know what we did this session, because know this, mental health is always a big issue, and it's always an issue that Texas has been committed to addressing, but we've never addressed it as profoundly as we just did in this past session. And there were several catalysts behind it. One lead catalyst was the aftermath of the shooting at Santa Fe. I told you earlier that what we did after the shooting in Santa Fe, we had these roundtables for 3 days that led to all these different proposals. In talking to experts from inside Texas, from outside Texas, from law enforcement, from educators, et cetera, there was one common theme, especially among those who had dealt with shootings in the past, including someone who served in the Secret Service, who studied the Columbine shooting, and that is mental health was always an issue that needed to be addressed. So we went into this session knowing that one thing we needed to address, especially with regarding the shooting-based issue, was to do a better job with the mental health. But then we built upon that, and we passed what's called a mental health care consortium that brings together all of our universities in the state of Texas, having them work together to address the needs that Lamont was talking about. We know that we as a state can and we must do a better job of addressing the mental health needs. So part of it is doing that study, but part of it is making more resources available to those who need it and informing people about how they need it or how we provide it. And so I'm glad Lamont asked the question, and just know that we provided a record amount of funding to address mental health needs in the state of Texas this past session.